173,000 people have died from the virus. And that's as of today. And so it kind of gives you the enormity of this in the United States. When you look in Virginia, if you want to hone in into Virginia, as of this morning, there have been reported 541,000 cases of COVID-19 in Virginia. And of those 541,000, just over 89,000 of those were in the Black community. When we look at deaths in Virginia, there have been about 6,958 deaths in Virginia due to COVID-19. And out of that 6,958, 1,619 of those were in the Black community. When we look at Chickahominy, my health district is Chickahominy, and that consists of Hanover County, Goochland County, New Kent, and Charles City County. We've had 8,898 cases of COVID-19 and 130 deaths. And if you look at the Black community in Chickahominy, the total number of COVID cases is 1,163, and 33 of those have died. So that just kind of gives you a sense of the just the enormity of COVID-19 and how it's affected not only our local community, but the Commonwealth of Virginia and the United States and in the entire world. And I hope that paints kind of a good picture of what we're dealing with here with COVID-19. Now, the good news that we finally heard about a couple of months ago was that vaccine was on its way. And in fact, the vaccine has arrived now. We've got 2 vaccines out on the market. One of those is the Pfizer vaccine, and the other is the Moderna vaccine. And other than socially distancing and wearing our masks and keeping away from groups of people and trying not to congregate, the vaccine offers us the most hope of anything that's been out there since the beginning of this pandemic. And it's really when I got news that the vaccine was on its way, it was the first time that I really saw some light at the end of the tunnel. And for the first time that I had felt encouraged in such a long time, since we first got word of the COVID pandemic in January of 2020. This was the first time that we've actually had a sense of hope and encouragement. And we're just extremely excited about this vaccine. Obviously, we've started the vaccine campaign. And I wanted to give you a little bit of a summary of the vaccine itself. And in Chickahominy, we're getting about 1,800 doses of the vaccine, and we're using the Moderna vaccine. I told you that there's 2 kinds. There's the Pfizer, and then there's the Moderna vaccine. We are actually using the Moderna vaccine, and we're receiving about 1,800 doses every week. And that's for a population of roughly 160,000 people in my district. And so if you look at those numbers, you can kind of understand why the rollout of the vaccine has been rather slow, not only in Chickahominy, but really throughout Virginia as a whole. 1,800 doses every week is just not enough to get people vaccinated in a timely manner. So we're having to be very, very careful and very methodical about how we distribute that vaccine and get it out to the community. We want to make sure that we get that vaccine to the community in a way that gets the highest risk folks vaccinated first. And these are the elderly people out there who have the highest risk of dying from COVID-19. We've got to get them the vaccine first, as well as the people with chronic medical conditions and underlying medical conditions that put them at risk of dying from COVID-19 should they get the disease. And so, we're trying to be very methodical and very smart and very ethical about how we distribute this vaccine and get it into people's arms. We want to make sure that, given a choice of 2 people, we want to make sure that the person with that highest risk gets that vaccine first. And so that's, one of the reasons why we're being so careful about these priority groups that you hear about, priority group 1A and 1B, where 1A being the healthcare providers out there who need the vaccine in order to take care of everybody in the hospitals and in nursing homes as well. and then 1B being the elderly, folks older than 65 and people with medical conditions, as well as what they call frontline essential workers who need that vaccine to protect them so that so that your community can keep functioning. And so that's the reasoning behind these priority groups, 1A and now 1B. We're in the middle of 1B right now and working our way down that 1B list. And after 1B is vaccinated, and I'll tell you that 1B represents roughly half the population of Virginia and half the population of my district. So if you include everybody in 1A and 1B, in my district, 160,000 people, that's half the population at least. And so you can see how long this vaccination process would take if we continue to get only 1,800 doses per week. Now, the good news is that there's more doses are being produced, and these manufacturers are getting more doses out there. And we hope that by come March time, maybe a couple weeks into March, that vaccine production will pick up enough where we start seeing more and more vaccine each week. And so we can start to vaccinate more and more people. We really, going back a couple of weeks, we had wished that we had 3 to 4 times the number of vaccine doses we were getting. We had actually asked for 3 times that much, and we only got about a third of what we asked for. And that's not only my district, but that's really Virginia wide. So we could definitely have used 3 to 4 times what we were actually getting. So the main issue with getting vaccine out is really the supply of vaccine is just not enough to really take care of everybody that needs that vaccine. But we are well into the vaccination. I will tell you, we started early January, and we're into February now. It's probably into our 6th week. And just to give you a sense of the numbers in Virginia, let's see if I can come up with the vaccine numbers in Virginia. Virginia, there have been over 1 million doses given out in Virginia. About 913,000 people have had at least 1 dose of vaccine, and that's roughly about 10% of the population. If you look at Goochland now, there have been about 3,000 doses given out, and that represents about just over about 12.7% of the population in Goochland has received at least 1 dose of vaccine. And so that's a little bit better than the average in Virginia. So Goochland's doing a little bit better, as is Hanover and New Kent. And so we're a little bit ahead of the rest of Virginia in terms of the percentage of people who have been vaccinated. And we continue to roll those out. So Goochland is 3,000 people have received a dose of vaccine. In Hanover, it's 14,800. In New Kent County, it's just over 3,000. And then in Charles City County, it's 661 folks. And you probably heard from Wendy that we had a special event this past Saturday. We were able to vaccinate, I think the total ended up being about 970 people were vaccinated on last Saturday. This was actually a record for Chickahominy Health District. We had never vaccinated that many in one day ever before in the history of my health district. So we were very proud of that and very happy that we were able to vaccinate so many people. At this point, I'm going to take a break and I want to ask if there are any questions about COVID-19 in general or questions about the vaccine.
So we do have some questions, Dr. Frank, in the chat.
Okay.
The first question is, what should I expect once I filled out the form online and they're in group 1B? Are you guys hearing me okay?
Oh, sorry about that. I was muted there. So that's a really good question, and I hope that everybody has had a chance to go ahead and fill out that form online and get your name on the list. So the quicker you can get your name on that waiting list, the better off you'll be. And when it comes to 1B, so 1B is divided is those folks who are the frontline essential workers, but also it's people 65 and older, and people 75 and older are really kind of in a higher tier because they're at much higher risk, and people who are 65 and older with underlying medical conditions are also in that high risk zone as well. And then folks who are 65 and older in general, and people 16 to 64-year-old with medical conditions are also at high risk, but they're in a slightly lower tier. And so we've got, when it comes to 1B, that phase 1B, we've divided that into different tiers based upon risk. And because of the limited vaccine, we don't want to just open up that vaccine clinic to just everybody on 1B all at once, because that's more than, like I said, it's more than half the population. And suddenly you'd have just a lot of people descending upon your clinics, a lot of whom have lower risk than other people with high risk who really need that vaccine first. And so that's why we're being very methodical about going down that tiered list, starting with the highest risk and then going down to lower and lower risks. And so, depending on where you fall in 1B, you might be getting an invite to come to a vaccine clinic, next week, or it might be 3 or 4 weeks from now. But I'm fairly confident that in the next 3 or 4 weeks, we will be able to open it up to the entire 1B group. We continue to vaccinate people in 1A as well. So 1A being that top tier, the elderly and long-term care facilities and healthcare workers. There are still some people in that group who have still not been vaccinated. So obviously we're going to continue to vaccinate that top tier 1A group while we're at the same time we're vaccinating the 1B group. But it's very important to get your name on that waiting list. And one way to do that is, just to let people know, it's if you will email CHD vaccine, that's C as in Charlie, H as in hotel, D as in Delta, vaccine at VDH, V as in Victor, D as in Delta, H as in hotel, .Virginia spelled out, .gov. I'll try to put it in the chat box here later.
Okay. That'll be great.
Yeah, CHD vaccine at vdh.virginia.gov. That's it. You got it. So thank you for doing that. If you email that, you'll get an auto reply back with a link, so you can link right to that form. I will tell you that next week, Virginia as a state will have a common tool where people can go in and fill out a common online form and sign up through one common online portal. But some folks who may not have good internet access or good computer, they can call in and get their name on the list by calling a common number, and that's 804-365-3240. 804-365-3240. And that's our COVID vaccine hotline. And you can get your name on the list that way if you don't have a good email or computer access.
Okay. I think another question is, and some of them kind of all come together here, but another question is, can you speak about, is it safe for people with allergies and for cancer patients?
Yeah, that's a great question. So when you come in for your vaccine, you'll answer a questionnaire. And on that question, one of those questions will be, have you ever had a severe allergy to anything, including vaccine or an injection or medication or anything else? And if, as long as you've not had a severe allergy to COVID-19 vaccine or any of the components within COVID-19 vaccine, you will most likely be allowed to have that vaccine. It shouldn't prevent you from having the vaccine. If you're somebody who has had a severe allergy like anaphylaxis, where you had to go to the hospital and get epinephrine, what we would do is we'll give you the COVID vaccine, but we'll watch you for 30 minutes instead of 15 minutes. We'll keep a close eye on you. we've given the vaccine out to a lot of people with history of allergies, and about the only thing that I've seen, and we've given out thousands of doses now. The only thing that I've seen is in one person with a history of, she had a history of anaphylaxis to a medication. We gave her the vaccine, we watched her for 30 minutes, and she started to have a little bit of itchiness. And we gave her Benadryl, and she did just fine. We watched her for another hour, and she did great. So far, as far as our vaccination clinics go, we haven't had anybody have a serious allergic reaction so far, but we're always watching out for it, and we're prepared for it. And we will watch those people with a history of allergy. We'll watch them for double the time. We'll watch them for 30 minutes instead of 15 minutes. But the only contraindication to, the only thing that would prevent you from getting a COVID vaccine would be a history of allergy to the vaccine or any of the components in the vaccine, like polyethylene glycol is one of the components within the vaccine.
Okay. And another question is, how are people contacted once they're on the list? Do you reach out via phone, email? And is there an email address that if you're sending it via email that people can put it in their address book so it won't get rejected as spam?
What'll happen is if you're on the waiting list, when your time comes, you will generally speaking get an email inviting you to participate in one of the upcoming vaccine clinics that are going on. And for some people don't have an email, they'll have a phone number on that list, and we'll reach out to them by phone call. Or you may get a call from somebody like Wendy when we have special events going on, and we're trying to reach high risk populations or vulnerable population. We'll go ahead and open that up, and we'll reach out typically by phone calls or emails, and we'll reach out to people and get them on a list.
Okay, very good. I think another question is, and I'm kind of gonna paraphrase some of these a little bit. So one question is, they've already filled out their forms. Can they get, how do they, how do you move down the list? And I think I would just like to say, let's be reminded that in this district, we're only getting 1,800 vaccines a week. So
right.
it may go a little slower than we anticipate. So as I think more vaccines, and correct me, Dr. Frank, if I'm incorrect, that as more things like Johnson & Johnson and different things come online, hopefully that'll increase the number of doses.
Yes, absolutely. So think about 1,800 doses. We're roughly speaking, we're going to be doing, starting in March, we're going to be doing about 3 clinics a week in Hanover County with about 400 first doses at each one of those. So that's about 1,200 doses dedicated to Hanover residents based upon population. And then we'll be doing about 1 clinic a week in New Kent with a population of about 23,000. And that they're getting about 250 doses a week. Goochland, about 23,000 people in Goochland, about 250 doses per week on the average. And then Charles City County, our smallest county, roughly somewhere between 75 and 100 doses a week. Those are the regular doses. Now, 1,800 doses. On top of that, I've been able to ask for, and I've received special doses for special populations. Like this past Saturday, I was able to get an extra 1,000 doses. I specifically asked, after hearing the governor and after hearing Dr. Danny Avula talk about reaching out to underserved populations and populations that were at higher risk, I specifically asked for 1,000 doses for the African American community, and they gave me 1,000 doses the very next day, which was amazing. And so, and that's why we have these special clinics for Hanover and Goochland, and we're going to do the same for Charles City and New Kent. We were supposed to do Charles City County today, but because of the weather, it didn't work out so well. So we're going to postpone that, and we'll do a special clinic for Charles City County and New Kent County.
Okay. And another question is, once Johnson & Johnson vaccine gets its emergency approval as expected, how soon might we see those vaccines added to the number of doses that become available?
Yep, I would say, and I've heard that the approval is right around the corner. It's not too far off. And I think the day that we get the approval, I think within the next week, we'll have vaccine in hand, is my guess. I think the very next day they'll start shipping it. And I have a feeling they may ship some of it to hospitals and some of it to the health districts. And I don't know how many we're going to be getting yet, but Johnson & Johnson should be really nice. There's some pros and cons to Johnson & Johnson. I would say the good thing about Johnson & Johnson is it's a one dose vaccine. You don't have to come back for a second dose, which is really, really nice. It makes it a lot easier on us and a lot easier on the community coming in for a vaccine. You don't have to plan a second visit. That probably the downfall is it may not be quite as effective from the data from the studies I've seen so far. It's a little bit lower than the other two that are out there, perhaps, but we'll see what the final trials show. But it is a one dose vaccine, which is nice, and it's fairly effective from what I hear. But we'll probably get more data on that soon.
Okay.
The Pfizer and the Moderna with 2 doses, the Pfizer and the Moderna are incredibly effective. In fact, I haven't seen another vaccine that effective in a long, long time. It's 95% effective after 2 doses, which is really rather remarkable.
And another question is, once you have the three different ones, when Johnson & Johnson comes online, as well as the Moderna and the Pfizer,
Mhm.
will you have a choice?
Right now in my district, we don't have a choice because we can't take the Pfizer vaccine and cold chain manage it. We don't have the ultra cold freezers. And so the ultra cold freezers are really hard to get these days. We ordered them way back. We ordered them way back before October, I think. And they were supposed to arrive in December. And then they told us that they weren't coming until March. So we have received ultra cold storage for the Pfizer. The Pfizer is really a lot more difficult to handle because it requires like negative 80 degrees centigrade, which is super ultra cold. And it requires these special ultra cold freezers. So because we can't take Pfizer, we're not doing the Pfizer vaccine right now. We're just doing the Moderna. I think the Johnson & Johnson will be easy to handle, like the Moderna is relatively easier to handle than Pfizer.
Okay. And we have several questions related to once you've signed up on one of the sites. So if you've signed up on the Chickahominy site, and then, some people are saying that they're now being asked to sign up on the CVS site. Can you elaborate on that a little bit? Should you just sign out on one? Are they merging together the information, or should people be signing up on both sites?
I would sign up on as many sites as you have access to.
Okay.
Yeah.
Okay.
Just to give yourself the best chance of getting the vaccine earlier. Yeah, don't be afraid. And if you live in one district and you work in another, I would go ahead and sign up on both sites. Because we're going to vaccinate people who if they work here in a certain business or a government, then they're eligible for a vaccine. And if they live here, they're eligible for vaccine. In fact, in Virginia, they're not really restricting it even across borders. If you can get into another jurisdiction and get the vaccine, go for it, because they're not really restricting that. And for an example would be Richmond International Raceway. We partnered with Henrico and Richmond and Chesterfield. So my 4 counties, we partnered with them, and we kind of combined forces and we combined doses, and we worked together to vaccinate a large group of people down there at RIR. We were doing 1,300 doses a day, and then we actually did 4,800 doses one day at Richmond International Raceway. And everybody in all of those districts were invited to that. They went off the wait list, but we took people off the wait list from all of those localities, those 4 districts.
Okay.
So that's one example of where you can go across border and get your vaccine.
Okay. And I think there's some comments saying that, the website is saying not to sign up on multiple sites because it does clog the process.
Yeah,
But
it does clog, but if you're I guess what I should say is if you're eligible to sign up on multiple sites, you should go ahead and do that. So CVS pharmacy, what we did is we were one of the few districts who actually we were organized enough where we had our waiting list all ready to go, and within 15 minutes of their request, we were able to load that data and give it to Virginia Department of Health, and they preloaded those names, and those people got notified immediately that they could go ahead and sign up for CVS. So we were able to do a really good job of getting people off from our waiting list, getting them onto that CVS email, and they got those emails where they could sign up really quickly and get on, because those appointments went really, really fast from what I understand.
okay, now another question is, how long is the vaccine good for?
So how long it's going to work and be effective, we really don't know. There's it's because it hasn't been out that long. They right now they don't know whether it's going to be good for 3 months or a year or 3 years or 15 years. We have no way of telling right now. The only thing that will allow us to have an answer to that will be given enough time when we follow people who have been vaccinated and then compare them with people who have not been vaccinated, how many of those two groups get infected with COVID-19. And that's when we'll know. And so it'll take a while before we have an answer to that. So that'll also determine how often do we need this vaccine? Are we going to need to get vaccinated every year? More than once a year, every few years? We really don't know right now. So those studies are being done.
Okay, and is there a way for folks to sign up if they wish to volunteer?
Yes. In fact, we have what's called the Medical Reserve Corps. The Virginia Medical Reserve Corps. If you go online and Google that, you'll be able to click on a link that takes you, and you can register to get onto the Virginia Medical Reserve Corps. And if you live in this area, you'll probably end up signing up for Henrico Chickahominy Medical Reserve Corps. There's a Richmond Medical Reserve Corps, a Chesterfield Medical Reserve Corps, and then there's a Henrico Chickahominy Combined Medical Reserve Corps. Really, all three of those groups are really kind of working together now in one Richmond metro region, and we share those volunteers. Without the Medical Reserve Corps, we couldn't do these clinics. There's no way. I have 8 nurses, and when I do a mass clinic like we did on Saturday, we had about 20 to 22 people at the vaccine tables helping out. And we had a few of my nurses were there, but most of them were Medical Reserve Corps volunteers. A lot of those were nurses, some pharmacists, some EMTs, and that Medical Reserve Corps is really the backbone of our clinics. And they're not only used for vaccination, but they're used for traffic control and registration, and just helping people in and out, and helping direct people to the right place. So we utilize the Medical Reserve Corps in every single one of our vaccine clinics. It's very important. So I would encourage people to sign up. It's also a good way to get your vaccine, because if you're a volunteer at a site, you're more likely to be able to get leftover vaccines at the end of the day.
Another question is, how are the technicians trained that are administering the vaccine? So, and more specifically, once you're given the vaccine, if they're coming to your vehicle to actually give you the vaccine, are they being watched as well as they are when they're inside of the clinic?
Yes. So really good question. The training of a vaccinator is it's a rather tedious process. It's a really intense training. Besides, you have to meet you have to have all the background, and you have to have either an RN and be a registered nurse, or a pharmacist, or a fire EMS paramedic, or intermediate EMT. and then you have to go through the training. There's a whole bunch of different vaccine modules take that are specific for Moderna vaccine and Pfizer vaccine. You have to learn all the ins and outs of Moderna and Pfizer. And then you come to one of our clinics and you have to be what we do is we place you as an assistant, and then you observe, and you get to help out a vaccinator over the course of a vaccine clinic. And you get to observe how that all takes place. And then you come back and then you get observed yourself. And we have one of our expert nurses, our trainer nurses, who actually observe you and walk you through. And then you actually get to vaccinate somebody. And we have a pretty lengthy checkoff list to make sure everybody passes, make sure that they're competent at what they do. And then you get to start vaccinating. And we continue to observe you and watch for quality assurance. And if you're getting vaccinated outdoors and like a drive-through in a car, we'll have you after the vaccine is administered, we'll have you park, and then we will have observers outside just kind of watching the cars for about the 15 minutes or the 30 minutes if they have allergies. And so that's the process that was used at Richmond International Raceway was that most people got the vaccine and went back to their cars, and then they had a paramedic just driving their golf cart back and forth up and down the parking lot, just watching for people. And we did one early event like that where we observed people in cars. We just had observers going around and just kind of walking back and forth amongst the cars. And ever since then, though, we have to sit down. We should have people sit down inside, and we watch them from inside.
Okay, and I think another question is, and this kind of ties in, once you've gotten on the list, should you get any acknowledgement that, that your information has been received? Is there like a master list that folks can go to and see, if their registration has actually been received by the health department or whatever list they're going on? Because quite a few individuals are saying that, they're signed up, they're 80 and above or 70 and above, and they have not received any kind of contact.
Yeah, and that's correct. And that up until now, there's been no automatic email back to them saying you've been put on our waiting list, and just you'll given some instructions and wait for us to reply back to you. So far, we haven't had that, but that's coming. So that acknowledgement, once people sign up, they should be getting an auto reply back to them, just acknowledging that they're on the waiting list now. So I don't think there's any system out there right now that tells you where you are in the waiting list, just because think of it this way: the waiting list is constantly changing. So let's say you're number 50 out of 100, and you are 65 and healthy, and you're 50 out of 100. But let's say now we get some nurses and doctors sign up and get on the waiting list. They're in group 1A, right? So suddenly they're put ahead of you. And so you just got bumped down a little bit because we had some healthcare providers join on that waiting list, and they have to be put to the head of the line because they're group 1A. So it's not just based on timing, how quickly you get on there. It's still based upon your priority group level. So you could get bumped down. On the other hand, you might have some people on the list may go elsewhere and go to Richmond International Raceway or go to North Carolina and get their vaccine, and then they get off the list. So you get moved up on the list if that happens.
Mm-hmm.
So it kind of goes both ways. But
there's no acknowledgement that once you fill out your form that you're on that particular list.
Yeah, I don't think there is, and that is a problem. And we acknowledged that I think it was last week or the week before, and we were trying to figure out from the form that we use, the link that we use, and the form that we're collecting is whether there was a way to automatically send a reply back to those folks who are entering their data. And the answer was no, we didn't know a way to do that based upon our technology. But
Hey, Dr. Frank, I just joined.
Hey,
Hey,
Caitlin, do you know the answer to that?
yeah,
So far, we have not been able to automatically reply back and say, hey, we
yeah,
acknowledge you've sent in your form, you're on the waiting list, just be aware, and then we're going to contact you. But I think
yeah,
that's coming, right?
yeah. So we were able to include a feature where you can get a copy of the survey you filled out for us, but it didn't happen till pretty recently. And so until then, I mean, we had thousands of people who didn't have any acknowledgement that their submission went through, and I know that's super frustrating. The good news is that the state is putting together like a new pre-registration portal that's going to incorporate our list already. So they're going to input what we've already gathered, and people won't lose their spot in line with us or anything like that. But people who get on there from our list and anyone who gets added afterwards, they'll have a special way to check where they are in line. So they can not only know that they're on the list, they can also check their status. So that will be extremely helpful. I don't know if you talked about this, Dr. Frank, but what they're proposing to do, and I think it is going to happen really quickly, is tomorrow night they're going to take off our local surveys that each health district has made for our waiting lists, our pre-registration, and then by Tuesday they're going to replace that all with the main centralized pre-registration portal. Probably on Tuesday morning, I think is the goal. And so that new portal is going to try to correct a lot of the different issues we've had with people not being able to know when it will be their turn, or not even sure if their information got through, which is super frustrating for folks. So we're hoping it will remedy that.
Okay. So
Caitlin, do you
Caitlin,
know, will they send do you think they will send an acknowledgement on this state portal? Do you know?
Yeah, so they will, and people can get like a text message acknowledgement or an email or a phone call. And so there's going to be lots of ways that people can have communication when it gets entered. We've asked them to do that. If it will all work perfectly is be determined, but that's one of the requests. And then we've been told that yes, they can do that. Everyone who's on there, even our loaded list, will get confirmation that they're in.
okay, so they will not have to register. So if you've registered on the Chickahominy site, those that are in Goochland, you will not have to re-register once the new list or the new form comes online. Is that correct?
Exactly. Yeah. So that's why they're turning ours off Friday night, and it's not no pre-registration will be available over the weekend through Monday, and then Tuesday that gives like all the IT guys a chance to get it all in there and organize it so that you don't have to, or whoever doesn't have to do it again. You're already in the list. They've incorporated our data. um, if there are any issues, we'll find out right away. But I'm very hopeful that it will work well. And I feel like really confident based on the trainings and discussions they've had with us, that they're addressing a lot of the issues that we ran into as we tried to develop these surveys, so they can learn from us.
Mhm, mhm. Okay. Another question is, will primary care physicians be administering vaccines, and do we know how soon they may go out to some of the PCPs?
Yes. When the vaccines start coming in larger quantities, and that supply chain opens up, then we will start, those medical practices will start getting their own allocation of doses so that they can start administering it to their patients. So far, it really hasn't gone to them yet. It's gone to the big hospitals, so the hospitals could vaccinate the the high risk doctors and nurses there, and then it's gone to the health departments so that we can get it out as equitably as possible to the people that are in the highest risk groups first. But as those vaccine supplies open up and they start coming in larger and larger quantities, it'll start going to most of the pharmacies and the doctors' practices, particularly the primary care practices. And then people will be able to go kind of wherever they want to go to get the vaccine.
Okay.
That's
And
probably going to be, probably a month or two or longer until we get enough vaccines to do that. And that'll be like priority group 1C and then phase 2, which is the general population of people.
okay. So just as a reminder, let's just recap a little bit for as far as the phone number. If you need to register and you don't have access to the internet, that phone number is 804-365-3240. That's 804-365-3240. Because we know not everybody has access to the chat here or internet. And so
Yeah. Yeah, and what's great is they return messages. So if you don't get in touch with someone, they'll call you back. And there's 12 people that work at that call center. So there's a really good chance you'll get a live operator if you call Monday through Friday between 8:30 and 4:30. And I think they do have to close though for inclement weather. So if it is as icy as it seems like it might be, the call center might be closed tomorrow.
Yeah, and also remember that that vaccine email box that we gave you earlier too. That's in the chat box.
that's in the chat, right? That's CHD vaccine at vdh.virginia spelled out .gov.
And if you might go ahead if you ask them where do I fall. I registered. Let's say I pre-registered in January and I still haven't heard back. Where do I stand? You might get a reply back if you do that. And somebody might be able to look up that list and say, hey, yep, your number, it looks like you're about a number 1,000 or 1,500. And, we're working down that list. And you'll get a sense for how much longer it might be. But if I saw a chat text here I think it said I'm 87 and I've registered, but I haven't heard anything. If you're 87, you should be hearing something really soon. If you're above 75 years old.
I was going to say, we have run into situations where the phone number we got isn't working. So we can't get in touch with the person to get the correct number, or the email we got bounces back. So sometimes the way the contact information was recorded, at no fault of the person who provided it. Sometimes it just has to do with how it was entered online. We do have issues. So I would say one thing you could do is to call the call center and just make sure that we have your most updated contact information. They could always re-enter you, and we go through and we see whatever the most recent entry is, and we'll use that one. And we'll make sure that we have better contact information. And so I think, yeah, it's really important if you are, or you know someone who's 75 years or older, please let us know, because we want to make sure those folks get appointments really soon.
Okay, right now, can we, Reverend Harris, can we go to our phone and see if there are questions?
Absolutely. And I have a question from Facebook Live, because you're live on Facebook as well. So I'm monitoring two different comment streams. But this question I'm sure is going to apply to a lot of people. If you have COVID-19 and you recover, how soon can you be vaccinated? I've heard that I've had COVID-19 and on my 40th day, I finally tested like negative, but I've heard that you don't really need it because your body has kind of fought it off. But the question is, if you want to be vaccinated, how soon can you be vaccinated if you've had COVID-19?
Oh, that's a great question. And we've seen this a lot because so many people have had COVID-19. You can come in as soon as you're out of isolation and you've recovered from COVID-19, you're allowed to get the vaccine. And we've done that with several people who have had it like a couple of weeks prior, but they've recovered and they just wanted that extra boost of immunity. So they've come in for their vaccine because they qualified for it. So you don't have to wait. We believe that there's pretty good immunity for around 90 days, for at least 90 days, that having the COVID-19 infection itself will provide you some immunity because you just recovered from it. And your body has seen that virus and it's built up some antibodies, and you've got some good immunity probably for at least 90 days or 3 months. However, you're still eligible to get the vaccine, and that vaccine will boost your immunity even more. Um, they say the vaccine, sometimes some people are saying that the vaccine could even be better immunity than having the disease itself. As I've heard that anecdotally. I don't know if that's really true, but so having the COVID-19 disease itself shouldn't prevent you from getting the vaccine. I just, in fact, I would encourage it.
And is that true even if you're still testing like positive? Because you can test like positive for a while.
Yeah, that's right. And I wouldn't worry about getting retested over and over. We're kind of trying to get people away from that, just because that test that we do, that nasal swab we do, it's so sensitive that even after you've recovered and the virus is dead, you may still have some viral particles in your nose and then your mucous membranes, and that still may test positive. Even weeks and weeks later, it'll still sometimes test positive, and it doesn't tell you that you've got the infection anymore. You're well over the infection and your body's recovered, but you still have the dead virus sitting in there, and that's why it's testing positive. So we don't even use we don't use repeat testing anymore, really, to tell people if they can go back to work or can they go back to the community. You can go.
About the COVID. Yeah, I'm listening to the live.
I'm sorry, that was somebody else's line.
Yeah.
I apologize. You can finish like your comment.
Yeah. So really, when you're after 10 days and you're feeling better and you don't have any more fever, generally speaking, after that point, that you can go back on that 11th day as long as you're doing better and you're no longer infectious.
And Dr. Frank, I just want to add to, maybe you already covered this, sorry everyone that I'm late, is that folks who are in quarantine, so they've been asked to stay home because they're close contact to a positive case, we want them to wait until their quarantine is over as well before they get vaccinated. And that's mainly because we don't want them to come to one of our clinics. We have a lot of people coming. We try to keep everyone distanced and safe, but it's really hard to make sure that's maintained at all times, because these are clinics where we're trying to get a lot of people through and be very efficient while also being safe. So we wouldn't want anyone who's supposed to be quarantined and staying at home coming to one of these clinics where they could potentially become a positive case and expose others. And that's also why we want someone to finish their isolation if they are a positive case before coming to get the vaccine as well. So just to, get that point home, please don't come to a clinic if you're supposed to be in quarantine or isolation.
Okay.
Good point.
So do we have anyone on the telephone that has a question?
Just hit *6 to unmute yourself. Just hit *6 and you can unmute yourself.
Okay, we don't hear anybody. Lisa, you want to go back to your questions in the chat box? You're on mute. Unmute yourself.
Last night, the Virginia Department of Health hosted a Vaccinate Virginia, a virtual town hall. The panel of experts on the call indicated that we'll likely be in phase 1B for another 3 months before moving to phase 1C. Is 3+ months in line with your thinking before we move to 1C, Dr. Frank?
Yeah, I would have to go along with that. Just given the number of doses we are getting every week and the number of doses we've already administered in Chickahominy, like I said earlier, we're a little bit ahead of the rest of the state in terms of the percentage of people vaccinated already. I think we've been doing a really good job. So we're probably moving down our list. Overall, we're quicker than the average Virginia locality. Virginia being just over 10%, and we're above 13% of people vaccinated already. So I imagine, I said earlier, the group, if you look at group 1A and 1B, it's over half the population. It's a lot of people. So when we vaccinated roughly 3/4 of those people, 3/4 to 75 to 80%, then in my mind, I'm ready to go to the next level. We've given people enough chance to get that vaccine where we're ready to open it up to the next level, which would be 1C. So I do think, definitely in 3 months, I think for sure we'll be in 1C for sure. I think I'm predicting that, I said 1B, we're kind of dividing up into tiers. We're being very methodical and careful about how we hand out that vaccine to people. And we want to make sure the highest risk people get it first. We're working our way down that list rather well. And so we're almost to the point where we vaccinated roughly half of the population 75 and older. And so we're getting really close to that point where we can just open it up to everybody 65 and older, regardless of whether they have a chronic condition or not. So we're getting close to that point, maybe in the next few weeks. And then we can open up to all of 1B in the next several weeks. And then we'll work on those 1B people that, that 50% of the population, and working our way down. And then once we get enough of those folks vaccinated and the vaccine keeps coming in good enough quantities, we can open it up to 1C. So yeah, I would definitely go along with that 3 months.
Especially if the weather cooperates and we can
Yeah.
have clinics, we
Okay.
can
Yeah.
list.
I would
Yeah.
say the only thing stopping us, holding us back right now, is the vaccine supply. We are ready to go. We can vaccinate 1,000 people a day easily in Hanover and Goochland and New Kent and Charles City County. We're ready to vaccinate 1,000 people a day. We're just waiting on the vaccine to come in.
Okay. I know you mentioned 3 clinics a week is what you were, aiming for. Will there any of those clinics be held in Goochland? Actually, I know most individuals are going to Ashland, but will there be any clinics for Goochland?
Yes. Yeah, we plan to have a dedicated day every week for Goochland County.
Okay,
And
but
we're also working with some of our partners there as well, like Goochland Cares. They are becoming vaccinators, and so they'll be able to hold their own little special clinics as well. And then as time goes on, we'll be getting vaccine into the pharmacist's hands and into the primary care doctor's hands, and they'll be able to start vaccinating too. But yes, we'll have a dedicated day for Goochland and a dedicated day for New Kent and Charles City County, and these 3 regular clinics in Hanover County.
Okay, yeah, because
And
some people just can't get, to
Yeah.
Ashland or in the respective areas. So.
we're hoping to start regular clinics in Goochland in March so that once a week there'll be an option in Goochland locally. We have started some regional opportunities at HCA West Creek. That's just in Goochland County, but it borders Henrico. So we've partnered with our other health districts and with HCA, and they've been able to do seniors with us. I think they started with the Pfizer vaccine was what they were offering, and they're pretty small, but it's been a regional event. So I know folks from Goochland have been invited there too, and it's been for senior citizens.
Caitlin, I think another question would be, if you receive your vaccine, when you come back for your second dose, is it typically going to be in the same place you received your first?
So it should be, I don't have a really great answer. So it all depends where you got it the first time. So if you went to one of our like regional events, like at the Raceway, they're trying to make sure people come back to the Raceway. If you got yours through a hospital, we want you to go back to that same hospital. If you got it from the Chickahominy Health District at one of our events at Randolph-Macon College, you might come back to the college, but you also might be coming to that newer location that Dr. Frank talked about that's on Junction Drive in Ashland, that's just down the street, because we're kind of wrapping up our clinics at Randolph-Macon in their gymnasium because they're not big enough. So we're trying to move those folks. So for the most part, they will come back to where they got it the first time for their second dose. But I think between the Ashland locations, where we might have people coming to that that newer place for us, Old Food Line clinic location.
Right. And will they be notified, or are they given that information on the card that once they're vaccinated?
Yeah.
We try to do both. Go ahead, Dr. Frank.
Yeah. So just recently we started giving those second dose appointments as on the way out, as they're leaving, they get those second dose appointments and they're told where to show up for that. Just recently, now that we have a regular site and a regular day of the week planned in March. And we hope to, going forward, what we plan to do is that as people get their first appointments, we're going to try to give them their first and second dose appointments kind of back to back, even at the same time, if they're willing to.
Okay.
There's a question in the chat about if you are not able to answer the phone when the health district call, will they leave a message or will you lose your spot?
Oh, so if somebody misses a call from us to give them an appointment, they won't lose their spot. And sometimes we'll leave a message. It just depends who's making the call that day. So we have a lot of great helpers that help us make calls. Not all of them have like their own VDH phone that they're using. So they might use a landline that's not monitored. So they might say, I'm going to try to call you again later as part of your message, like please answer. Sometimes will leave a voice message and a number, but don't panic if you miss our call. We don't cross you off the list or move you to the bottom unless you actually get your vaccine at the appointment. So you don't get crossed off the list at all until you've been vaccinated.
Dr. Frank, can you speak to people who have had heart surgeries, cancer, and I think we had some people who had recently taken shingle shots, and when should they take the shot?
So the COVID vaccine needs to be separated from any other vaccine by at least 2 weeks. So try not, you don't want to get any other vaccine within 2 weeks of your COVID vaccine. So that's one thing. In fact, the Moderna tells us we're not supposed to give the vaccine if you've had any other vaccines within 2 weeks. And then after your Moderna vaccine, you should wait 2 weeks before you get any other vaccine. And the main reason for that is they just don't want to mix up side effects from one vaccine with the other. The other question is if you've just had surgery or you've had cancer or been put on a new medication, as long as your doctor thinks you're stable and you're healthy enough to go into the community, you can come in and get a vaccine. In fact, we want you to. We had somebody who just had surgery done like within a week, and he came in and we gave the vaccine. So yeah, as long as your doctor thinks it's safe and your doctor has cleared you and you're out of the hospital and you're feeling pretty good and you're not having fever, then you should be eligible for the vaccine.
Okay. What about dialysis patients? Is that the same principle?
Mm-hmm. Yes, same principle. Yeah.
I know that we had a clinic scheduled for tomorrow, and I don't know if anyone is on this call that was scheduled for tomorrow, but you should have received a call from the health district rescheduling you, and because of the inclement weather, and that may come up multiple times on this project. If the inclement weather comes up, the health district will contact you and give you a new date and time.
Yeah. So anybody who was planning to come tomorrow at Randolph-Macon College should come in next Wednesday, the February 17th, roughly the same time, over at the food line, the vacant food line on Junction Drive. So, but we contacted just about everybody, but there may be some people out there still who are waiting or have been left messages. They're just being moved to February the 17th, next Wednesday.
Okay. Dr. Frank, you have any closing remarks? Caitlin, you have any closing remarks? I don't know. Lisa, do we have any other questions? Reverend, you got any on Facebook?
I'm sorry, we had some Zoom like bombers trying to enter, so I had to remove them.
Yeah.
But we got them out the meeting.
Good job. Good job.
Good security guard. Thank you.
Right.
It was quite appalling, I would like to say.
Someone saying something? Okay. Well, since we seem to have exhausted our questions, if you have a question and you're particularly on the phone, it will give you one last time to come in. That means hit *6 and come online. And I see a couple of hands up. If you would just unmute yourself and ask your question.
Hi, I'm on the phone. Can you hear me?
Yes.
I have a question. My 92-year-old dad lives with us, and I have registered us all on the site. The day Tuesday, I got an email from you guys that I was sent to CVS to get the vaccine, and I got the link for CVS. Except Tuesday was the day that CVS gave out all the appointments before the people in the health department could actually register for them. So we were unable to get one. So what happens to me or us, particularly my 92-year-old dad, who you believe has sent off to CVS, is he no longer in your system? And what do I need to do to make sure I get him a vaccine?
Hi, this is Caitlin. So he's probably still in our system. I really doubt we took him out because we don't know for sure that he got vaccinated. And so obviously he did not. So if you emailed us, that would probably be the best way to that CHD vaccine at vdh.virginia.gov. And we can make
Can you
sure.
say that again, because I'm on the phone and I don't
Sure.
see that on your screen.
Yeah, it's the like Chickahominy Health District. So CHD vaccine at VDH, like Virginia Department of Health, .Virginia,
Okay.
all spelled out, .gov. If you email us there and just explain that you got the email about a CVS appointment, but you weren't able to make one, they filled up so fast. You just want to make sure that, especially your 92-year-old family gets another opportunity as soon as possible. We can make sure that we get that appointment. So thank you for letting us know. Sorry that you didn't get one with CVS.
Right. Well, yeah, I don't think anybody got one with CVS. So I did call the hotline number on Wednesday, and somebody was supposed to get back to me within 24 hours, but I haven't heard. And now you're telling me that probably nobody's going to be there tomorrow either. So
What's your, do you mind sharing your,
get an answer Monday.
name? Do you mind sharing your name with me?
I'm going to share the name of my dad. He's
Okay.
Stanley Sidor, S-I-D-O-R.
What's the last name again?
Sidor, S-I-D-O-R.
F-I-D-O-R. Okay.
And
That's like in Sam.
is it your contact information or does he answer the phone for himself?
It's my contact information.
Okay.
And my email address was what was in the system and what I, how I was contacted through my email.
Okay.
All right. Got it. Thanks.
Okay, thank you.
There any others on phone? Okay. I saw a couple of hands up, but you disappeared. So hopefully you put your question in.
One of them was a hacker, Miss Hobbs.
Huh?
One of them was a hacker.
Oh, okay. Okay, good. Okay.
I had a quick question. I guess about herd immunity at the rate that we're going now and the anticipated vaccinations. What percentage are we looking at that we might meet herd immunity? What time frame are you looking at? Is that going to be around the 1C tier, et cetera?
Yeah, that's a great question. So the herd immunity will be a combination of the people who have already had COVID-19 infection and they're immune. We know they're immune for a certain amount of time. And then the people getting the vaccine, they will have immunity for a certain amount of time. And once that number gets to be about 70% to 80%, then we should have pretty good herd immunity where the vaccine stops spreading around different groups of people. So between those two groups, when we get about 75, 80% of people immune either through vaccine or because they've had COVID infection, then we'll be there. I'm guessing that it'll be by summertime, probably, I don't know, early summer, midsummer, late summer. But I think sometime in the summertime, we will have herd immunity. And then we'll see this kind of this at least this year's epidemic kind of go away. And then we'll have to wait and see what happens next year.
And we'll want to see when children start, they're included right now in some clinical trials for COVID vaccines. So that will help as well if those trials go really well and then younger people can start to get vaccinated too.
Thank you, Caitlin, because that was a question that someone had asked about children being vaccinated under the age of 16. So thanks for sharing that information. Are there any other questions before we kind of wrap things up?
Wendy, can we just share that phone number one more time for those who don't have internet access?
Go ahead, Lisa, you got it.
It's 804. So if you don't have internet access and you want to get signed up for the vaccine, that number again is 804-365-3240. 804-365-3240.
Okay, before we wrap up, Dr. Frank, did you have anything else you'd like to share?
No, I'm just really thrilled to be here with you all and to be able to answer some of your questions. I hope you learned something, and I hope this has been helpful to you all. And I just, again, I'll just say what I said at the beginning. I'm just really, really encouraged and hopeful now that we've got this vaccine and we're starting to get it out there in the community. It's been a long, long time since I've had this much hope and encouragement. So thank you for just allowing us to share this information with you.
Great. Caitlin, you got any words of wisdom for us?
No, just thank you all. And just if you do get the vaccine, even if you get both doses, just please remember to wear a mask when you're around people that aren't part of your household. Still maintain 6 feet and keep washing your hands, because that will help everyone as well. So just because you got your vaccine doesn't mean you shouldn't keep doing all those other safety measures. We want to make sure, like Dr. Frank said, we'd really love to get a lot of folks vaccinated by the end of the summer. So we got to keep people healthy in the meantime. So thank you.
All right. Well, I want to say to Dr. Frank and Caitlin and their team is awesome. I had the opportunity to go to the site Saturday. It is organized, it's well ran. You're standing in line for a long period of time. You go in, you give them your name and they send you right on your way. You're in and out pretty much in 30 minutes. That's how efficient they are. And so I want to say to the Chickahominy team, thank you so much for being willing to come online and to talk with us in the community about what's going on. This session has been recorded and it will be posted. It is on Jerusalem Baptist Church in Mannequin Sabbath's Facebook page. I will send, Reverend Harris will send it to me and I will send it to you guys, Caitlin, so you can post it on your page and we will post it on the NAACP page. And I want to say thank you to Jerusalem, Reverend Harris and Jerusalem Baptist Church for allowing us to use their Zoom. to do this tonight. I want to thank the Ministers Conference, the Christian Association, and the Health Department for doing this together with us so that we can get information out to the community. And remember, those people that have been calling me, you have to be at least 65 years old to get on the list and have underlying conditions. If you're 75 and older, just get called and get on the list. And we're working with the health department to try to get as many people vaccinated because we want a healthy community. So again, Reverend Harris, you have anything? And Lisa, you have anything to add?
And Wendy, one more thing, Wendy, Dr. Frank here. Even if you're under 65, you can go ahead and get yourself on the waiting list as well.
Yes.
It'll just take a while, but it'll take longer, but go ahead and get yourself on the list regardless. Thanks.
Okay.
Ms. Hobbs.
Hello.
Ms. Hobbs, this is Robin Allen.
Oh, hi, Reverend Allen.
And we've been on the whole time, and that's on behalf of the Baptist Ministers Conference in Goshen and vicinity. I want to thank you for the presentation tonight. We had a large number of people to go to Hanover County on last week. Everything went smooth. We also had a large number of people to go over to the Randolph-Macon Sports Center on Tuesday, and everything went well. So I want to take this time to thank you all for what you do.
Thank you. And is Reverend Hennigan on? Mike Hennigan, are you on? Well, Reverend Allen is also a part of, he and Reverend Harris are part of the Christian Association. So Reverend Harris, you want to wrap us up?
Yeah.
Ms. Hobbs, I have one question. Dr. Frank, you're saying that even everybody should go ahead and get on that list. I'm 55 with no underlying health conditions. I should go ahead and sign up now.
Yeah, Caitlin, do you want to back me up on that? But I think the answer is yes.
That's
Yeah.
not talking. Okay.
Yeah, sorry. So our local list you can get on. Wendy's helping with making a list of senior citizens. So our local Chickahominy Health District waiting list, you can definitely get on there. You just won't expect a call or an appointment very soon. You'll be very patient. But yes, you can. And then when the state has their new centralized pre-registration, you'll get imported from ours right over to them. So you'll still.
That means I send an email to that email address with my name and phone number and age.
You can do it that way. You can also go, if you're, tech savvy, you can go to our website. We have a link to our sign up survey. So I'm happy to send that out. It's like kind of long to read, but I'm happy to send that out to Wendy or whoever else would like to share it for people who want to just sign up themselves online. It's pretty easy.
Great, thank you.
Any other questions? Thank you, Lisa, for being our moderator with questions tonight. And Reverend Harris, if you can close us out in your final comments.
Well, just thank you, Ms. Hobbs, for organizing it and everything that you do for the community. Thank everyone who showed up. We definitely want to thank the health department. Thank Lisa for being our scribe and our facilitator for the questions. We thank the people who were giving me messages about Zoom hackers as well. So I've learned to do some of everything in this new age. So just praise God for you all. Definitely to my colleague, Dr. Allen, who we are part of the Ministers Conference, and Dr. I'm sorry, I call him Greg so much I had to think about his last name, Dr. Washington, Gregory Washington. Thank all my colleagues for being here, and just have a good night. Don't get a speeding ticket like going home, and just have a blessed night. Thank y'all for all that you do, and definitely get vaccinated. Whenever people talk about the side effects of the vaccine, I said, well, I've had COVID. Trust me, take the side effect over having COVID. Okay, so a sore arm or whatever. You don't want COVID, and I can attest to that. All right, but thank y'all so much.
Okay, well, thank you again, everyone, for tuning in and calling in. We hope that you've gotten some valuable information. We have a great team in that Chickahominy, I can tell you that. So they are working hard to protect our Goochland and Hanover members here that are online tonight. So thank you again. Have a good evening.
Good night.
Thanks.
Thank you.
Good night, everyone.